The importance and usage of basic, advanced, and pediatric life support courses. Basic life support, BLS, advanced life support, ALS, and pediatric advanced life support, PALS, courses are essential training programs for healthcare providers and first responders to acquire the skills necessary to effectively respond to life-threatening emergencies. Mastering these abilities can mean the difference between life and death for patients in critical situations. The BLS course focuses on establishing initial care for victims of cardiac arrest or other life-threatening medical emergencies. Participants learn critical skills like high-quality chest compressions, basic airway management, and the safe use of an automated external defibrillator, AED. BLS skills can help sustain life until the arrival of emergency medical services providing more advanced care. BLS is the foundation of all advanced resuscitation training programs. Courses are offered in many formats, from brief video-based training to full 8-hour classroom programs to teach both laypeople and professional responders. The Advanced Life Support course builds substantially on BLS abilities. ALS training utilizes in-depth instruction, scenario practice, and simulations to sharpen the complex decision-making and treatment skills needed to treat adult patients experiencing medical crises like cardiac arrest, respiratory failure, stroke, and major trauma. Skills covered include advanced airway techniques, intravenous access, pharmacologic therapies, recognizing and treating arrhythmias with appropriate medications or defibrillation, and team dynamics. ALS measures allow for the continuation and optimization of care begun under BLS through more invasive or advanced interventions. ALS courses have both classroom and practical components over 2 or more days. Different ALS programs exist for pre-hospital providers and various clinical fields. For example, Advanced Cardiovascular Life Support, ACLS, is designed for cardiopulmonary specialists, while Advanced Trauma Life Support, ADLS, focuses on managing major trauma in the emergency department setting. ALS training aims to ingrain effective emergency response patterns that utilize both critical thinking and psychomotor skills in life-threatening situations. Pediatric Advanced Life Support applies the concepts taught in ALS courses specifically to infants and children suffering cardiopulmonary arrest or critical illness. The 2-day PALS course utilizes lectures, case-based learning, and intensive hands-on skills training focused on the anatomy, physiology, and common emergencies seen in pediatric patients. PALS teaches the recognition and management of shock, respiratory failure, and cardiopulmonary arrest in children. Core skills include pediatric basic and advanced airway management, vascular access, medication administration, defibrillation, effective CPR, arrhythmia recognition and treatment, crisis resource management, and special considerations for stabilizing neonates. Both ALS and PALS courses utilize scenario-based learning with sophisticated mannequins that can simulate real-world conditions. This experiential approach promotes the rapid and efficient application of complex cognitive, technical, and behavioral skills necessary during high-acuity, low-frequency pediatric emergencies. PALS emphasizes interdisciplinary team leadership and communication to prioritize time-sensitive interventions, allocate tasks, and avoid errors in the high-stress pediatric resuscitation environment. The knowledge and competencies gained through BLS, ALS, and PALS training are vital to improve outcomes for acutely ill or injured patients across the lifespan in pre-hospital, emergency, intensive care, or general ward settings. Though materials cover specific skills, these courses also promote an understanding of organized algorithms and team dynamics that enable coordinated and effective resuscitations. Ongoing renewal courses and training are essential to maintain proficiency in these critical life-saving abilities. BLS, ALS, and PALS certification has become mandatory for many professional responders, physicians, nurses, and fellows. Completing these programs allows participants to approach emergent cases with greater confidence and helps ingrain best practices for managing crisis situations. In summary, basic, advanced, and pediatric life support training provides healthcare teams with standardized frameworks for patient assessment, diagnosis, and management during vital first moments of a medical response when timeliness and appropriateness of interventions strongly influence chances